My name is Janice Agarwal. I'm a pediatric physical therapist. I've been doing this for about 23 years, primarily just Prader-Willi syndrome. Before that, I was a developmental specialist and in Boston and New York evaluating young babies all over the states. So, and I will tell you that when I had my son Alex, we started the Packages of Hopes, and we started trying to change the way people saw our kids. So I've been part of this organization for about 23 years. My son Alex is 23. I have seen from babies, I see more babies than anybody else from a therapist point of view. Dr. Miller and I do a lot together. And the information I'm going to give you, if you follow, because I have followed enough kids over 20 years, I know it works. Okay, I know what doesn't work, but I know what does work too. So the information we're going to give you is information tried, true, tested, and I'm going to try to give it to you in as easy way as possible with things for you to go home right now today with. Okay, so I have a son, Alex. That's who I am. Angela, can you just quickly tell them who you are?
Hi, I'm Angela Gustafson. I am a speech therapist. I have been doing private therapy for the past 10 years, and prior to that, public school system. But I work primarily with pediatrics, and it's what I love to do. I love working with children, and like the birth through 5 is kind of really where my niche is, but higher than that as well. So what I'm going to talk about when it comes to my portion is like how to find a therapist that works for your family. I think that's super important to discuss because, different therapists have different perspectives, and it's important to find the one that works as a unit with your family and not just, I'm here for therapy and then I leave. So we'll get to that in a second, but.
Yeah, who we are is not really important.
Exactly.
Quite honestly. Okay, because I want to get going on this. And so what I've done, I've kind of condensed this down. That is my family, like back in the days. And I'm going to show you some of the cutest photos you've ever seen in your life. In my opinion. I'm going to show you some of the things in the developmental part, but we're going to briefly talk about that. And the reason is because I want to take that development and show you as a parent how to move forward with your child in a way that is effective and is fun. Because therapy for kids needs to be fun, because that's what kids do. They learn to play, and through playing is how they actually learn to develop their skills. So the face of Prader-Willi has significantly changed. It's kind of hard nowadays to see which one is which, right? So the blonde is my son Sam, who's now 6'6", and the redhead is Alex, and you've probably seen him running around. He's now 23 years of age. So we're going to talk about the therapeutic intervention. And as a physical therapist, and also with your OTs and PTs, we need to have a really heavy sense of motor with sensory. And so a lot of OTs or people now will come up and say, when we have these babies that are not moving, okay, they don't have any sensory issues. That's all they have is sensory issues. Because they weren't moving in utero, because they're not moving, that's how we develop, is through our movement and feeling things and seeing things and hearing things. So the sensory and motor, they're parallel tracks, and that's how our children learn. So I believe the first couple years are the most critical time that we have with our children, which is why I love to be a part of this part of our program, because now is when you make the most effective changes. I know you heard in the interview with the geneticist yesterday, start speech at this time, speech at this, OT at this time, and PT at this time. I say you start it the day that child is born, as soon as you possibly can. These kids need as much input as possible. Again, they weren't moving in utero. They're not moving when they come out, and we need to get them moving in the correct positions. We need them to start feeling all of their movements so they understand how to duplicate it. So the basic issues are the hypotonia, which is that low tone. So your therapist should be working to try to change how they feel that stuff, how they bring things to their mouths, how they bring their feet to their mouth. Our children are kind of difficult. They're a little bit floppy, so they're harder to handle. So it's great to have someone coming in and showing you how to handle a child. I will tell you, I do have a video out there that the Irish folks put together years ago where I will show you with our babies how to start handling your child, how to let them lay on the ground and how to position them. I encourage you to go do that. We put these together because we couldn't always get everyone together, so we're trying to get you as many resources as possible. So when we're looking at this, I love support. Support doesn't just mean your arms and your hands. You know, one of the things you can do with our babies is put tight clothes on them. So not so tight that you're suffocating them. But, you know, if it's a onesie, it should fit very, very tightly. I love tights. I love tights. As soon as you put your hose on do people still wear hose? After the summer, we start wearing hose. And do you ever notice when you put your hose on, especially like the ones that give you all the, you know, comfort and control, that you really start to notice them? Well, what we notice is as soon as we put tights on our little babies, they start moving their feet. So as soon as we put little things on their tight stuff on their arms, they start moving their arms, right? Because they feel their arms. They really don't feel the world. Their hypotonia leads to hypersensitivity, which leads to inability to know where their arms and bodies are in space. So we want to include that. We want to give them as much information and input as we possibly can. Head control. Head control is the most important thing we have. So when we're talking about feeding and talking and sitting them up, we want to be sensitive of that head control. We don't want them to have floppy. We don't want their heads to fall forward or backwards in a quick motion because that is really scary. That is really scary. So in the young ages, when they're in a carriage or cradle, we do want to give them that support, but we also want to give them the ability to be moving, okay? So with that head control, one of the best and most effective ways to do that is putting our babies on our bellies. But according to all the literature outside, they say, oh, don't put your babies on your bellies. And if you put them on their bellies, they get really, really upset. But what happens on their bellies? Well, first of all, on the bellies, they have to pick their head up to start to see things around them. They have to start picking their shoulders up, right? They got to get on their arms. And what does that do? That builds the muscles on their arms. And then as they get higher, it builds their muscles in their hands. I look at a lot of our babies, and they've got little pudgy hands. That means they're not building the musculature in those hands. The other thing it does is their respiratory system. So many of our kids have respiratory issues. On their stomachs, allows their rib cage to hit the ground in gravity, and it helps pull that down so that baby can get a breath. If you put them on their back, you will see the rib cage come up. So they will not be developing their lung capacity at a young age as effectively as they can. So we encourage you as often as possible to put them on the bellies, so they can learn to explore, they can learn to develop their shoulders, their rib cage, their hands, and one more thing, visual. So how we learn visual is we start learning to see things up close, right? So as they're on their bellies and they're looking at something, they start to see, okay, this is where my little phone is, and eventually they'll try to pick up that phone or they'll try to touch it. They'll take that opportunity, and it may take a while because our kids have different levels of tone, but they need to learn that. And as they learn it, they go, okay, so that's the distance there. But if they can't reach that toy over there, they'll learn that maybe I have to roll to get that. And what does that do? The acuity of their eyes, it starts to help develop that. We do have kids with strabismus, which means one of their eyes comes to the side, but not all the kids have that. But we want to encourage that visual ability. Where does that come? Most of it comes on the bellies. If you've got them in a chair and situated, they will never be able to really reach out and learn those distances. I'm just noticing I might be a little fast for you. Good. Whew, I never thought about this. This is so awesome. Sitting. So I was trained in England, and that's important because there were lots of Germans there. And the German Fraus used to say, never put a child up to sit until they can get to the sitting position themselves. In our children, that is huge. And why is that huge? Our kids have the way they develop is distal to proximal. Means that this part is the last part to develop. So they want to move their arms and their legs first, then arms. We want them to sit up. I am a parent. Now just think about this. I'm a pediatric specialist. I have seen babies for almost 40 years. I had my own son, and I had to watch as my other son and all the other kids developed faster than he did. But I knew in order for him to reach his optimal abilities, I was going to have to take a step back, cry those tears, watch my son not be able to do things developmentally. When people say, so is he standing yet? Is he sitting yet? And me going, no. I'm going to tell you I understand the heartaches. I get it. Therefore, listen to me on this one. Do not bring your baby up to sitting until they can sit by themselves. Because as they're learning to sit by themselves, they've had to do on the ground, on their belly. They've had to build their shoulder musculature. And by building their shoulder musculature, it slowly moves down to their pelvis. And then they come up to a little bit, as they bring their pelvis, they learn to creep or crawl. Once they start learning to that, they've got the ability to maintain the posture when they get up to sitting. And therefore, you're going to decrease scoliosis, you're going to decrease the respiratory issues, and you're going to increase the ability of our kids to develop their trunks. It is huge. It is huge. I cannot say that again, but it's huge. The other thing it does when they're sitting, we'll answer questions at the end. The other thing we're going to tell you is that as they start to develop, as they get the strength on their arms, on their belly, and then they slowly learn to move up, what do they develop? They develop equilibrium protection reactions. And what is that? Well, at 3 months, when a baby is, if they can come up, they start to learn to put their hands forward to prevent their heads from hitting the ground. Around 6 to 8 months, it's on the side, and around 12 months, it's behind, because everything for a baby is about how to protect their head. Because when they get up to standing and they start to walk, we want them to protect their head. Otherwise, they'll be so fearful of falling because they don't want to hurt themselves. So as we're building their chest and their trunk, what are we doing? We're actually looking forward so that when they do walk and run and have a great time and get part of Special Olympics and get their little gold medals, our son got a gold medal in swimming. So. They're not afraid. They're not afraid to fall. They're not afraid to get hurt. And that's a really important thing. I think that's one of the biggest reasons to keep your baby down. Creeping. So they're going to learn, most of our kids are going to learn to creep, commando crawl, before they ever learn to walk. And the longer you can wait for them to walk, the better, okay? Crawling, so creeping is on their bellies. I was just up in the infants. We've got some babies creeping and rolling and doing wonderful things, and that's awesome because they're building all of the basic structures that they need to build, and it's so important. Once they get to that point, once they start pulling to stand, first off, look at AFOS, okay? That is the time I'm saying you don't really need anything on their feet until they're gonna start to stand, but look at those feet, because most of our kids will probably need some kind of AFO intervention. But once they start to pull to stand, then they're gonna start moving, and then everything, you gotta start locking everything up ahead of time because you don't want any anxiety to learn about that. And if that being the case, go talk to Utah. They've got some amazing stuff going on out there. But once they start that, then you gotta baby-proof the house. You know, which is fun too. And then they start to walk. So these are the basic that we're gonna talk about, but now what I'm gonna do is take you from these basic things that everyone's talking about, and I'm gonna teach you as a parent how to work with your child using all of the tools that we have so they can get more normalized developmental milestones. So the missing link has always been the sensory integration. Now on that sheet of paper I've given you a series of ideas of things you can do. I did not come up with these ideas. I have teams of therapists that I've been working with for 40 years. We all come up with this. I don't claim to know anything more than anybody else that I work with. But that's my kid skiing. Okay? Our kids are so capable. We take our kid all over the world. Parents say, well, we were a really active family. Can we still be active? Absolutely. You just have to adapt. You're going to have to adapt. Things are going to be a little bit slower, but that's okay. You're going to make accommodations for this stuff here and there, but that doesn't mean you can't do it, and that's the goal. The goal is to get these kids up and running and moving and trying to be as normal as possible. So, what is sensory integration? Well, so basically, the way we learn, we have a motor path and we have a sensory path. And our body learns to take that information in and process it. So my body knows that my right hand is up, because my sensory system is intact. My body knows that when I'm chewing, I'm moving my jaw correctly. See, our kids don't always know that. They don't know where their tongues are. They don't know where their bodies are in space because, once again, they started out so low tone and they weren't moving. Normally, kids are doing triple sow cows in your stomach. Normally babies are constantly on the move and they're all night long, they're moving, and our kids are not. So we have to impose that upon them. And honestly, you can make this fun. So we see on a lot of these kids, and this will cause a lot of behavioral problems on the things that we're seeing. So addressing these, by the way, will address a lot of their behavioral problems ahead of time so they don't happen. So a lot of our kids are just incredibly aware of all the noises around them. And that's often called auditory processing issues. And that's something, as your kid hits about 5 or 6, think about making sure you get checked so that they can hear one person talking to them as opposed to a whole room making noise. So that when you're speaking to them, you understand that they're actually hearing you as opposed like that. So if I had said a full sentence, they would not have understood it because they might have heard a bunch of rustling in the background. So when the teacher says, Johnny is not listening in class, he's going, I am listening. I just don't hear. Or when you're speaking to them, they don't hear everything you say because their body and their hearing is hearing everything around them. And that's something we need to be aware of. They become fascinated with everything around them. We need to work on sensory because we need to get them acutely aware that they've got to think about more specific stuff. And then sometimes they go too specific, and then we have to open the world. They like to take things apart. They have coordination issues. That's going to be one of the biggest things, and we're going to work on that. They have difficulty with transitions. So if we start working on sensory, we will start working on their ability to do transitions. I am not a big clock person, and the reason I'm not a clock person is because our kids are. So if you say, okay, at 3 a.m. or 3 p.m. every day we're going to do this, what happens if your schedule changes? If you've got 3 other kids and they've got to go to 3 different places and there's a schedule and 3 o'clock you don't do it, that kid's going to melt down. I say do it in increments. Okay, so in 15 minutes we'll do that, or the next time we see something, or find another way to make them understand when something's going to happen, because I guarantee that's going to bite you. I will bite you big time when it comes to the fact that it's 15 minutes after 4 and you don't have something on the table, or you need to go do something else, because we are families and we have a life. I had other kids. I have a life. I have to be thinking about how can I set my child up to integrate into a family that is constantly changing. Unless you're a time Nazi, and most of us are not, we need to integrate everything so that they understand how they fit into our family and they fit well, and that we're not dealing with wondering, okay, if I don't get him this right now, something's going to happen. Don't live that life. You've got the ability to change it right now. So, sensory integration is the ability to process and organize the stuff around us. It affects the motor skills. Again, if you can't feel it, you can't move it. And also the social behaviors. A lot of times we see these kids they're in lines with other kids and someone just touches them and they melt down. They've got huge sensory issues. If you're working on sensory processing stuff, that's not going to happen, okay? So we're going to start talking about vestibular. We're going to do proprioceptive, tactile, and oral motor. I go through that so you can see the cute pictures. We took our kid to Africa for 6 weeks, by the way. He was brilliant. He was brilliant. And we had so much fun because my husband is a physician, I'm a physical therapist, we'd go to the hospital, we would take them with us. My one son would teach kids how to play toys. Alex would hold babies, little orphaned babies, and feed them all day long. African people would say, your son loves our babies. And we're like, you're right, he does. Because my kids don't see anything but love. They see heart. These kids are the most beautiful kids you're ever going to know. They are so loving and kind, and they love to help others. So, vestibular. What is the vestibular? The vestibular is an inner ear. Because we're short on time, I'm going to skip stuff. In our ear, we have this little vacuumed area that has this piece inside of it, a vestibular piece, and it's kind of a three-dimensional thing. And what it does, it tells us where our head is in space. And that's how we know when we're bending our head, when we're looking for protective reactions, we're trying to keep their head up. Kids like their head righted all the time. So normally with a little baby, when I go do an evaluation, at day one, a baby starts picking its head up. Our kids don't. When you put them over your arm, they flop. They're not picking their heads up. They have vestibular issues. So from day one, what I recommend, I love spinning. I love rocking babies. I love, nowadays we have like those hammocks that are great because hammocks do a couple of things. We'll talk about the proprioception later, but we want to constantly be moving them. Moms can, go side to side. Dads, mom, I'm just going to say this. Moms, let the husbands take those babies and roughhouse with them a little bit. They're going to cry. I mean, I would come home going, are they crying or laughing? My husband would throw them up and do the whole flying in the air kind of thing, And I have so many mothers say, but every time my husband picks the baby up, he cries. Okay, let him cry. It's good for their lungs. They need to do this. I had a dad. I told him, I'm like, okay, so you need to start rough housing with your babies. Have fun with them. Do rolls. Do anything you can. And the dad came back a couple years later, big Harvard graduate lawyer, burly guy. And he said, David waits for me at the door every day now to wrestle. I always wanted to do that with him. And now he waits. They love roughhousing. They love the spinning. They love when you take their feet and you roll them back and forth. Anything you do once, they're going to want to do 1,000 times. Be prepared for that. But they're going to love that. And what is it doing? It's developing the vestibular. And we know by research that you can develop vestibular from day 1 to day 110. So if something happens and you go in the hospital and your balance goes off, you work on vestibular. You work on rocking. They cannot rock enough. They cannot spin enough. You cannot do enough vestibular because that is all about their balance. That is all about protecting their heads. That is all about their safety so that they can do higher level skills. On your sheet, I know on this sheet that I just gave everyone, there's a section called vestibular. Look at some of those activities. Circle one. Circle one that you can go home right now and you can do it every day. Just one. I don't want two. Yes, husband?
There are no more sheets, but if you guys use any web browser and look at PWSA USA Young Child, those 3 words in your browser.
PWSA USA Young Child, you'll find this sheet. We put this sheet together for parents. Circle something. Circle one thing that you're going to go home and do, okay? Because you go home from these conferences and you're a little overwhelmed with everything. I need you to commit now to say that my child is important enough that I'm going to do one thing on that sheet. There are fun things to do on that sheet, I promise. I love large balls and mattresses. Oh my word, we had big air mattresses in my house and my kids would run and hit them. They'd jump on them. I don't care. Make your house the most fun house in your neighborhood so everyone wants to come to your house and play. Those big bouncing balls or roadies, let them bounce on those balls once they can sit. Don't do that before they can sit. But what you can do is while they're laying down, again, you can bounce them on there and put them on their bellies to do it, and their mouth will hit the ball, and they'll start learning to make noises, and those noises are awesome. Awesome. Who cares if they spit? Just take it, clean it when you're done. A little bit of bleach and water. That's what I do. So as they get older, hopscotch games, soccer, baseball, trike, scooters. So I don't know if they still have that in Minnesota, that indoor park, but before every single year in Indiana, we have the big state fair. Before we started school, every single year, no matter what age, Disney World, I would take my kids and we would do the worst rides ever, the ones that everyone gets sick on, and we would have the best behaved kids ever. And because we have worked on their sensory system, we have really pounded their system, and they need that. They relax with that. See, where it might make you sick because you're getting old and you haven't been working, remember when you were a kid? It invigorates you. It just blows your endorphins and says, let's go, right? That's what they need. They need it, and you will have a better behaved child. When my child is misbehaving, that's the first thing I would tell the school. I'm like, go get him on a trampoline. We'd had a little trampoline there. Go get him doing something to stimulate him so that he could actually relax. It actually, if you think about it, makes a lot of sense. When I was in grad school, I went and I would run before I'd actually go study, because then I could actually think. Again, roughhousing, wrestling, somersaulting, mom's gymboree classes. You go, but my baby is so young, and is this good? You can accommodate everything, but you would be surprised. I mean, those big foam pits, just throw them in. And then go find them. But the other thing about vestibular, which is going to be really important as we think of our kids as they get older, is vestibular also can have a calming effect. And by a calming effect, if you do a slow, rhythmic rocking, that is going to calm that child down. So if you know your child is going to go into a really bad situation, we're going to have a couple different strategies for that, but this is one of the strategies you can use. You can know that they can calm them down. Don't let them go and have a bad eruption. You can preemptively strike on a lot of these things. If I know my son's going into a situation where there are a lot of people and there's a lot of excitement, I'm going to work really hard to get his body ready for that. Before he went to school every single morning, the way we would feed him, we do deep tissue massages, we would do a lot of different stuff before he went, so that when he went to school, he was ready to go. That's him. Proprioception. So what is proprioception? So proprioception is a body awareness. And what it means is that every single one of your joints, you have this sensory system. And what that does, it tells your body where your joints are, right? So if I jump like this, my body, all the different joints feel that. So your proprioception is the thing that tells you that your arm is here. It's the thing that tells me that I can move side to side and do all that. It's my body awareness and that knowledge of what's going on. Proprioception is a huge tool. It also, coolly, so we have parents that talk about kids holding little chicks and they accidentally squish them because they don't know how much force they're using. That's proprioception. That's something we want to teach our kids. As they develop it, they develop what is light and what is firm. So when they're learning to write, they're not like their pens aren't, you don't see the whites of their cuticles, right? That's a really important thing. It's a really important thing to understand force. If you're going to throw a ball hard or soft, if you're going to jump far or not so far, or if you're going to run quickly or not. That's our body, our proprioception. Look on your sheet. You're going to see some things that you can do, okay? So what proprioception is, we can start with deep brushing. Deep brushing. What I would do every single night, the day my son was born, I would pick a movie or the news, I'd stick him in front of me, and I would do deep massages. I'm not massaging his skin. I'm like literally massaging his bones. And he would love it. To this day, we still do that. We send him to massage therapy or whatever that place is, and he only wants the one who does the deepest, hardest, the ones that you'd be like, stop! He needs that input. Every single night, that's how I relaxed. I would stick him in front of me. I have other kids, get the whole thing, put him in front of me, and I'd do deep massages, no matter what. When I would send him out, I'd always have a really tight T-shirt on. Those T-shirt makes him understand where his body is, right? Socks. Socks were a little tight. Not so tight that I cut off circulation. Don't go there on that one, but I got it. At school, I made weighted blankets. You can buy them. I know there's a woman up in Canada who makes them, and I've actually bought some from her. Amazing. but I would put washers and things. We would have a big heavy snake with sand at school that he would put on his lap during different things. We're looking for things that are weighted, because once they feel their body, there's a comfort in that. And the comfort in that is a thing called serotonin. So let's talk again about this one. This is really important. So you have that day when everything is going wrong. And I mean everything is going wrong. I've had a couple of those. And you come home and just about anything that anybody says could blow your mind away and you want to scream at everybody. Has anybody ever had those days? A couple times. Have you ever been hugged so deeply that all of a sudden you start to almost shake, and then all of a sudden you go, has anybody ever had that? Because that is what good proprioception and a good hug and deep tissues can feel like. Because when adrenaline is going so fast and so hard and they can't stop it, if you can get in there with deep tissue massage, something heavy, or a big old honking hug. My husband would say, I'm squeezing the juice out of you. Squeeze. And they'd be like, and then at the very end they'd go, and you would see a total relaxation. So when they say they're going to have a meltdown, let it happen, I'm saying if you see that thing coming, don't let it happen, because they don't want to be out of control. You want to teach them how to have control. My son would go and say, I need my blanket. I need this, because he knew it was happening because we were training him to do that before a big situation. Give them the big old hugs. Squeeze the juice out of them. When they come home from a situation and they're a little on edge, squeeze the juice out of them. That is something that's going to help them, because you're going to stop that adrenaline off right at the pass. And it's the only thing that can do it. It is a known, it works every single time. It works. When we had little babies back in the days when I was part of early intervention in Boston, what we would do, we had a big old bag, a big bean bag, and then we'd have another bean bag, and we'd put that on a child, and we'd actually lay on top of them, and you would see the child take this deep breath, and they'd start making noises because all of a sudden they'd relaxed. These are the kind of things that you can do for your children that are going to allow them to be successful, so they don't have to have a lot of those issues that a lot of parents are talking about. I'm not saying it's never going to happen, but I'm saying you can give them tools to control more of it. Gross motor activities. Do you ever notice that the more you work out, the better you feel? You feel great. Well, you've got the endorphins kicking in, but you've also had that serotonin relax you. So the bigger activities, get them out there. One of the things I did, I would hide treasures in my gardens. We always had sandboxes. I always had pirate hunts. And they're digging, or they're taking their bags, and I would put big weights in a basket, and they'd move it around the house. They would move, at school, he would take books down to the library and then come back. I mean, not just books. We're talking like heavy old books. We're always trying to get them to do big stuff. Backpacks, get it to fit just right and put some stuff in it. Get some weight on those kids. Hammering nails. There are so many fun things you can do, little kid toys, that's working on their fine motor, it's working on their gross motor, but it's really working on their proprioception. What it's doing is it's teaching their body how to move, teaching their body how to duplicate, replicate, get moving all the time. So you're like doing all of this together. So gross motor and sensory always go together. So some of the treatments, okay, that's like one of my favorite things are baby elephants. I swear we should have a baby elephant in my Indiana farm. My husband won't let me. I always had things that they could push and pull. The other day, in October, we have a fall fest, and we had these big wheelbarrows, and we fill them full of pumpkins, and we have these kids moving them back and forth on the fields. And those kids are the best behaved kids in the world. I love swimming in bath time, get them. So you'll see pictures at times of my kids with more bubbles. I would just literally get a book, put them in the tub, scrub them down, and then I would read my book while they played. Let them play in the water. You know, learn to walk like a silly animal, tumble on the ground, take them to things. There are so many opportunities. Just circle one. Just circle one thing that you say they can do. Tactile. So tactile is, you know, our skin. So it's a lot. And it provides all the information about light, touch, pressure, vibration, temperature, and pain. And they will tell you that all of our kids have issues with this. So we all have thermal regulatory issues. They don't feel a lot of stuff. So they're telling me I got to go faster. They're stressing me out. Tactile is really important for body awareness. It's really important that you work on tactile. You'll partially work on that when you're doing all that deep pressure and that massaging. I actually like to do things where I'll put like warm things and cold things and different things on their skin so they start learning. Teach your kids. Teach them what they feel like, right? But you got to be doing, we have a lot of kids that won't put stuff on their heads. I have parents, they won't put gloves on. Go in and deep massage their heads. Deep massage their hands. If they don't like walking on grass, you go in and you massage their feet and you get them out on that grass. Do not let their sensory issues at this age determine how you proceed in life with them. This is the age that you can correct everything. And I truly mean everything when it comes to sensory and motor. You can correct it now when someone says, he just doesn't like it. I don't care. I don't care. He has to wear a hat because when he gets on a horse, he's going to have to wear a helmet. Let's just go there for hippotherapy. If he's in the cold, he's got to wear those gloves. He's got to wear clothes, and he's got to look good in clothes because if you have sensory issues on your skin, you're going to look frumpy everywhere you go. Who wants a frumpy kid? I mean, let's just go there. You know, I want my kid to look like every other kid in that school. I don't want him to look different. I don't want my kid having tantrums. I don't want my kid doing other things other kids are not doing because I want my kid to be cute. I want to love my kid more than anything else in the world, and I want everyone else to think that. I want everyone to think my kid is cute. And you know what? He may grow up and some things are going to happen. But I know that I did everything I can and that I love taking him places because he's cute and he's well behaved. We go to a restaurant, and if one of the kids misbehaved and it was actually the other kid who did it more than the first, we'd had 2 cars, and they're gone. I give them 1 shot. I never give 2 warnings or 3 warnings or 5 because if you give them 2 warnings, they know I can do it twice. Once they know they can get away with it, they're going to get away with it. Don't let them. Don't let them get away with it. This is the time that you can change. You can change everything right now. So I'm going to say light touch. Beware of light touch. So it's kind of like the fingers on the nail, on the chalkboard, right? If you do that kind of like light touch on their skin, they are going to wig out on you so badly, and you're going to have a meltdown. If you go to touch someone, you touch like you're going to grab onto their bones. Okay? You never just lightly touch anybody. If they melt down, it's your fault. If you touch them lightly. Okay? Because that is one of their biggest protectives. Everyone's protective. No one likes light touch. If you do, you're kind of weird. So again, we talked about hats and gloves, insect bites. So, you know, everyone's talking to you about the picking. Well, you know what? If you do sensory, and if they have those bites, you go in and you deep massage, put a Band-Aid on it, and you can walk away most of the times. Sometimes you can't. I mean, that's just life. Because sometimes I have a hard time with that, especially the ones that really hurt. But for the most time, you go in, you do the massage, Band-Aid, and you're not going to have the kind of picking that other people are going to have. You want your kids to like finger painting and glue. I love sensory toys. I go to pet stores, I go to sensory magazines. I mean, I had always had things going on because I want my kid involved in as many things as possible. I did have permission from his father. So we were at Yellowstone National Park, and before we leave the house, he'd have to have a massage, but then he learned that he likes massages so much that he'd give us a massage. That is the greatest perk ever. The other thing we did is they have massage like bugs and stuff like that, the vibrating things, get those and massage them. And you know, sometimes, you know, like you're like, wow, that hurts. They don't think that. You know, and that's just a fun thing that they can work with. I love it when they're walking around, and you're like, this is so cool. I'm working on balance, proprioception, and I'm laughing. Deep rolling, deep massage, deep pressure. This is all about having fun for therapy. Okay, so did you go on your sheet? Because speech therapist is coming, and I'm writing my time, I know it. Go on that sheet, look for tactile, circle something. You have to circle something. From my point of this thing, if you go home with 3 things that you're gonna do, and you're gonna do them, then I feel like this would be a success. Your turn.
Wow. Hello, everyone. All right, let's skip ahead here.
Is that not you?
Not quite yet. Oh, no, I'm going backwards. It was upside down.
Okay, because I thought
There we
I had
go.
you next.
All right, there we are. Okay, whenever I do a talk about speech, I like to talk about the muscles in the face first, because I don't think people realize what a coordinated effort it is just to smile. It takes 5 muscles to smile, like 10 total, but it's 5 muscle pairs to be able to smile. We have cranial nerves that we need to move food around in our mouth. We have cranial nerves that affect how our mouth is frowning. Total, there's 43 muscles in the face. So if any of these things are not working together, or if there's low tone in some, not in others, it's going to be difficult to get speech to be fluid. It's going to be difficult to get eating to be fluid. So that's just something I like to kind of put in perspective for everyone, especially when we're working with children with low tone, is that there are so many things happening at once just to smile, right? So what I wanted to do with this presentation is kind of talk about what are some things that you can look for in a therapist, not necessarily should this therapist be doing all of this stuff. Every evaluation, articulation, language, it doesn't matter, should have an oral motor assessment component. I use the Beckman oral motor protocol. There are lots of them out there, but what your therapist should be doing is having their hands on your child's face, in their mouth. They're looking at how their tongue is moving. They're looking, are there tethered oral situations? Like, could there be a tongue tie? Could there be a lip tie? They're also looking at your child's tonsils. They're looking at the roof of their mouth. That is such a critical component for the assessment, and if your therapist is skipping that, maybe ask them, hey, did you do that oral motor component? Because we need to make sure that the articulators are moving correctly, that they're structured correctly. And then I put some common evaluations. I get a lot of questions about this from parents. What does this mean in evaluation? What is the Goldman-Fristow? What is the Pre-LS5? These are standardized tests. So a standardized test is a norm reference test that's compared to other children that child's age. So it's gonna give you 100 as average and 15 points, plus or minus, we call those standard deviations. So the reason why I find these so important is for data collection. Like, we need to know, is our therapy working? And 6 months from now, can we compare that score to the previous score and show progress? If not, then we need to look at a different set of therapies. Common language tests you might run into, preschool language scales, clinical evaluation of language fundamentals. If your child is in the school system, you're probably going to see that one quite frequently. The comprehensive assessment of spoken language. I know apraxia gets thrown out there a lot with children with Prader-Willi syndrome, and there's a couple of them that are standardized. So I would ask that question. When it comes time for evaluation, are you using a standardized assessment for my child? Now, we can do things in conjunction with standardized tests. We can do language samples, we can do observations, but it is vital that we have a data point. Because if we do 6 months of therapy and we have nothing to compare to, it's not showing that we're showing progress. We need to make sure that what we're doing therapy-wise is what's best for the child, and if we need to make adjustments, we make adjustments, but we have that hard data to be able to show. And honestly, in this time period that we're at now, insurances want to see it too. So if you want to make sure that your child's insurance is getting covered, a lot of the insurances are going to look for these standardized tests. So you don't want something to come back and say, oh, insurance isn't going to cover language therapy for us. Well, let's look back at the evaluation. Did you guys have a standardized test that the therapist sent in? That's important. Okay, Evidence-based therapy. So evidence-based therapy has been trialed in situations and settings, and it's been proven to work in the area that it's aiming to improve. So these are just a few examples of evidence-based practices. Prompt therapy is evidence-based. It is not the only thing that can be used to improve your kids' articulation, their language skills, but it is evidence-based. Integrated phonological awareness training, cycles approach. For my apraxia kids, the dynamic temporal and tactile cueing for apraxia of speech has been proven to be effective. The use of augmentative alternative communication. I do get this question a lot. If my child is using an AAC device, will that stop them from using spoken language? And the evidence says no. If anything, it helps enhance communication, spoken or nonverbal. So please don't be afraid of using augmentative alternative communication. And if your therapist is not willing to kind of point you in the direction to be able to use that, then that is a question that needs to be asked. And it can look like all kinds of different things. It can look like picture cards. It can look like tablets. A lot of times there's funding for this through public school systems, through grants, through universities. I know if you're in Central Florida, the University of Central Florida has a grant program for this and testing. So if this is something that's not in your therapist's wheelhouse, you can be, shown in different directions and get the evaluation, elsewhere as well. And play-based therapy. Play-based therapy is evidence-based. If you have a 3 or 4-year-old and they're just sitting there doing flashcards constantly, that's not going to show improvement. If that's what the primary mode of therapy is that your therapist is working on, it's not natural. It's not going to be generalized to other parts of their life. Play-based therapy is evidence-based, and I highly, highly recommend it for that, even over the age of 5. It really depends on where your child is developmentally. Therapy should be fun. It shouldn't be, what's this? What's this on this card? What's this on this card? Watch my face. What's this? It has to integrate other systems as well. Oops, I think I went one too far. No, I didn't. Okay, here we go. All right, so this is the main portion of what I wanted to talk to you guys about, is what to look for in a speech therapist. I get this question a lot. Your therapist only has your child sometimes once a week for 30 minutes. Sometimes it's 3 times a week for an hour, and amazing if you've got that. But if you look at the entire week, that's still just 3 hours. Your therapist should be able to clearly and effectively communicate what the goal of their therapy is and show you how to use it. So if your therapist isn't letting you in that session or showing you, hey, this is something that you can try at home, little bit of a red flag. Ask to be present. Don't be afraid to ask to sit in on the session. Don't be afraid to ask, hey, can you show me how to do that oral motor exercise? Or can you show me what you're doing with your prompting on the face? It may look like practicing a new sound at bath time. That might be your homework. That when it's bath time, all right, we're gonna work on our bubbles, and it's fun. It's a generalized natural environment. I'm very big on using natural environments versus we drive to the therapy office, we sit in the therapy chair, we do the therapy, we go home. That's not going to maximize your child's success when it comes to language and speech development. Your therapist should also be providing you that robust evaluation. Some of those tests that I showed you at the beginning, they should be doing all of these things. They should be doing a standardized assessment, your oral motor assessment. They should be asking you what your personal family goals and dynamics are as well. You should be a part of that evaluation and that goal writing, because everybody's families are different. Like, some goals that work for some kids may not work for other kids, and some things that may be really important for you as a family can be incorporated into both the goals and the therapy. I'm big on inviting siblings to participate as well. Like, as long as it's not like, they're taking all the toys and running around and, running away with it. These are the people that are going to be with your child the most, not the therapist. So what I encourage you to look for in a therapist is somebody that does not just therapy, but education for you guys as well. Also, collaborating with other therapists. So especially when it comes to feeding, If I have a child that has weak trunk support, I need to be talking to OT, I need to be talking to PT about what's the best positioning for this child. What utensils should we be using? So that may look like needing to sign a consent form to share information with OT and PT, but collaboration is key. You know, if we are not positioned correctly, we can't use the muscles that we need to speak because we're working so hard to hold ourselves up. Same thing for eating. So collaborating with OT and PT is vital. And a family approach. If you guys can find a way to have a meeting, whether it's, we have so many things at our fingertips technology-wise, Zoom, FaceTime, you know, if you guys can have a meeting together so that everybody's on the same page and everybody is working together, it will maximize the success, speech, OT, PT, everything. And also, making sure that you guys are touching base with your therapist. Your therapist should be collecting data, you know, each session. And if the data is flat, or if the data is showing like a decline, then what we're doing isn't working, right? It's time for us to take a different approach. So I think not being afraid to ask those questions of your therapist is important. And it's okay if your therapist isn't working out to change. I know sometimes it's hard because, you know, we're such a vital part of your child's life sometimes, but it's okay to say, hey, I think we're going to go into a different direction or see a different therapist. That's okay. I get that question a lot, and just know, like, you are your child's biggest advocate when it comes to maximizing their therapy. And if it's not working, and that's okay to find a different fit. So I wanted to have enough time for questions. We have like 4 minutes or so, but I wanted to make sure we had plenty of time for that. So does anyone have questions for myself? For Janice? All right, we'll go yellow first and then back here. Okay.
Hi, so I hear a lot about prompts,
Mm-hmm.
and I was talking with another woman, another mother this morning, I don't know if she's here, but she's an SLP as
Uh-huh.
well, and she was wondering where that came from. In her opinion, she's wondering if it's more, dysarthria versus prompt, and she was questioning where this whole prompt idea came from, and she's wondering if it's actually more of a hypotonia issue than motor planning with PWS.
I think, so the question was, where is the prompt piece coming from, and is it more related to dysarthria? Sorry, I'm repeating it because since it's recording. And I think it does have origins there, but they have shown that it is effective with children with hypotonia, because some of it is the cueing piece. So a lot of children, not generalizing everyone, but sometimes children with PWS and other, areas too, have difficulty with the visual cues. So the tactile cues that come with prompt are very helpful in that situation, if that makes sense. Does that answer the question a little bit? Okay.
I was curious because with speech, we really haven't been moving too much, and they've kind of got a little bit frustrated. But a lot of the time when they're actually working with her, they'll just they'll say a word, and if she babbles and it actually isn't it, they still act like she said the word. And I wasn't sure if
is it close? Is it an approximation, or is it no? Okay.
So they just keep if she just kind of babbles at all, they act like that's what she said.
Gotcha. Okay.
And I didn't know if this was actually a really good way or just kind of stunning her in the way of actually
it is.
realizing.
So if you see that, that is, there is a strategy. So if your child, if you say something say milk, and they say something kind of totally different, and they still get excited about that, right? Oh, you wanted the milk. There is a strategy to that to increase the desire to communicate more. If you provide a verbal communication, a verbal reinforcer to that, it increases the desire for that. But in the context of therapy, sometimes I would encourage maybe some different modalities too. If the word is more, let's work on an approximation of the sign, or work on shaping the for more as well. I think it's important to encourage the continued back and forth that happens with speech, but in a specific therapy situation, I would kind of look at some different modalities for that. So, any other questions? Questions?
Yes.
Today. Yeah. So, in my experience with that age, we did a lot of oral motor therapy. So we did a lot of working on strengthening tongue, range of motion, lip strength, and then also at that age, baby sign, like doing, even if the more isn't all the way across, if we just have one hand that's going with its communicative intent, it can help reduce frustration for that. So 10 months old absolutely can do something like that.
Thank you.
So the question for this, though, is what is therapy? So back in the days, back in when we all started, therapy was 3 times a week, and your child would get OT, PT, speech, they may get some behavior. So right now, what is happening in many of our states, they are trying to delay that. Your child should have started it at day 0, right? So your children should be getting all these therapies at least once or twice a week. I would encourage more. That is something for you to fight for. And a lot of our states are trying to take that back, but your children are going to do better with more therapy. Just what she was saying, an hour a week is great, but you know, the children are going to change. You can catch a child when they're sleepy one day, you know, or you could catch when you're not having a great day. Things happen.
Yeah.
So that second visit is huge, or that second visit 2 days later takes and expounds upon the very thing that they got that first day, whereas a week from now, at the rate our kids grow in the first year or two is so exponential that we're going to miss things. So encouraging you to get as much therapy as possible. And if they say, well, we don't start PT or speech until they're 6 months or 10 months, or they don't need oral motor right now, no, that's not true. And you can say oral motor, and I don't want an OT doing it. I want a speech therapist doing it. Because that's huge, because that oral motor, it goes right into their speech ability. And that's one of the biggest questions we are having, our parents going, I can't get therapies.
And that's why I also included that slide about the standardized test. You are more likely to be able to prove to your insurance companies that your child needs the therapy if it is a robust assessment. You know, show this is the score, this is where a child at their same age should be scoring, this is why we need therapy 2 times a week versus just the 30-minute.
And
one
speech
time.
therapist 0 to 6 months is a real thing. You know, and I can guarantee every one of our kids would fail. They would be at least 2 standard deviations.
We have one more question in the back.
Yes, I was going to ask, because with my daughter, where I take her now, they're saying, like, she cannot have speech till she's, like, 16 months old. So how do I go to them and tell them, like, hey, my daughter needs this now. You have to do this now. Like, they're going to be like, no, you're absolutely not.
So the preschool language scale is 5. One of the tests that I put up there is rated at age 0. Like, you
Okay.
can get a score at age 0. Not saying that, like, that has to be the only thing, but if they need that documentation, they can do that evaluation.
Ask them,
Yep.
I want my child to be tested to confirm whether that is true or not, and what test would you recommend?
For that one, the preschool language skills would absolutely
Write that down so that you know it.
Okay.
Okay?
And we also, they stopped doing OT with her this past week too, because she's drinking all her bottles and taking her purees and stuff. And she was doing like vital stim, but they've stopped all of that. So now she's doing PT once a week, and then we do early on twice a week at our house.
So 16 months,
And
would-
she's only 7 months old.
So what's
gotcha,
happening
okay.
is the OT is doing the oral motor, and they've kicked out the speech. I would, in my world, as a mom, I'd go, no. Okay, first off, speech should be doing oral motor, and that will evolve into speech. If the OTs are coming in, you want them to work on their sensory and their upper extremity as much as you possibly can, and then that speech should be doing all of the above. PT and speech work really well together. What she was saying is if we don't have the strength here, we can't get all of this working. So you want that PT and that speech therapist communicating really weekly almost on how they can exponentially increase your child's ability to get all of that working.
And you can ask for their, not only the language evaluation with the PLS, you can ask for the speech to do a feeding evaluation as well. At 7 months, you could even argue, all right, well, they're doing their bottles, we're ready to move on to a straw.
Yeah.
So
Okay.
that could
Straws
be.
are like the best.
Yes, I wish
But-
I could have done a whole section on oral motor, but we were limited
Well,
on
and there-
time today.
on your little
Yeah.
thing has a whole thing on oral motor. But
Okay.
I will tell you, that is a common thing going on in every one of your states where they're letting one therapist do more of the stuff. You do not want that. She trained hard for this. She knows what she's doing when it comes to oral motor and how that evolves to speech. I know what's going to happen when it comes to sensory and motor. That OT should know what they do with sensory and fine motor. The states are trying to save money, and your child is not going to benefit from that. You need to go back to them and say, I just came back. This is what we should get. And you need to demand that the right people do the right jobs for your child.
Okay.
and things that, come as evidence-based, identified, intervals that all these people are talking about. They give you things to give to your county or your insurance company or anything.
Okay.
You're not the expert.
Okay. Thank you. Can you tell me the name of that test one more time?
It's the Preschool Language Scales 5th edition.
And all you guys write this down if you have young babies, okay? And you go back to the office, and if you have a question, if you're not getting what you need, you call them up and you ask them for the standards so that you can ask specifically those therapists to do what you're asking them to do.
Yeah, and those early questions in that one are like, is your child locating if you shake a rattle? Like there are definitely, like, it's developmentally appropriate for like the building blocks for eventually speaking is what they're looking for in that test, and it's able to be evaluated at that age too.
And I don't think any of our kids are going to pass that one. I mean, we can help you get evaluations done. You got to ask though.
Yeah.
And again, it's getting harder and harder and rarer. And I will tell you, there's no such thing as a virtual visit. And the reason is there's no such thing is our kids are so wonky. They feel different. And I've been doing this a long time, and on a virtual, I'm like, okay, maybe pick them up, or you can't. They need to have hands-on. Everything is hands-on, okay?
Yeah, that oral motor evaluation is critical, but it requires your hands to be on, around, touching, moving.
And if they're not touching your baby, get a new one. Really. I never have a problem firing a therapist.
All right, I think we had one more question, and then I think we are
What would be a
Gonna
good
be
eval for like a 5 to 6 year old?
5 or 6 year old for language or for articulation or
For language.
for language. The clinical evaluation of language fundamentals is one that you're going to see a lot within the school system. It's okay. If developmentally we're still kind of a little bit lower, you actually can use the preschool language scales. I believe goes all the way up to 7. That one can give you a little bit more to work with when it comes to goal writing as well. And then another one is called the CASL. It's CASL.
CASL?
Yep. And then if my go-to ones for that age are definitely the SELF and the PLS, though. Those are the two that I recommend the most.
This should be a 2-hour lecture.
It really should.
I know.
Anyway, honestly,
I've never done this in
I
this
had a
quickly.
hard time whittling things down,
This
so
is
I
crazy.
appreciate the questions
Yeah,
for
no,
sure.
No, this should be 2 hours. Yes.
Thank you.
And so she sits, and it's kind of like from
No.
orthopedics, and now from you today, do we just not sit anymore? Like,
So again, I know this is going to be hard to hear. No. Because I
Right.
guarantee if you keep her on her belly and you get her creeping and crawling, and you will watch, she will get to sit. So, I
Okay.
put kids in different levels of tone, our kids, right? We have the super babies all the way to the kids that will not even get head control till age 1. Okay? I happen to have that one. And he still got to sitting, and he got to kneeling, and he got to standing. It just takes longer. But what I didn't have, what were a lot of the other issues that a lot of parents had with their, the chest was kind of concave, they had the respiratory issues, they didn't bring that rib cage down, their hands weren't the same, they weren't as strong. So did I enjoy that? Was it fun? Was it a pain? Absolutely. You know, it's what you need to do. And again, I can promise you, doing this a long time, if you do it right and you deal with the beginning, you will see the big benefits at the end.
And I think you've always mentioned that you want to hit those milestones in the right order, because developmentally that will make the child develop more appropriately. So you don't want to do one thing before the other.
Absolutely. So this comes with all of our therapies. You know, you start with oral motor before you get to speech. You start with on the floor before you get to standing. You want that progression, and you know why you want that progression is because all the intricacies in between all of that are huge. They're huge. It's easy to sit with the parents, and that's all they want to do is go, oh, is he sitting? Blah, 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 blah. They're not. They're not. She's not getting to herself. Okay, and I would encourage you not to do that. From my heart of hearts, been there, done this many, 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 many times, and I've had parents come back and go, thank you, because now my kid is doing this, this, and this, you know. It makes a big difference.
Guys, thank you very much.
Right. Thank you, everyone.